Welcome to Momentum for Change, Voices of the Missouri Movement. This is a monthly podcast produced by your coalition, and I am your host, Nora Mosby, a member services specialist at the Missouri Coalition Against Domestic and Sexual Violence. We hope that you enjoy this conversation coming to you directly from Voices of the Missouri Movement. Some episodes of Momentum for Change have conversations that include content and descriptions of domestic and sexual violence, which may be alarming or activating for some listeners. Please take care and visit the MOCADSV website or call our office to connect with supportive services. Welcome to episode 9 of the 4th season of Momentum for Change. This is your host, Nora Mosby. As summer comes to an end and fall is right around the corner, many students are headed back to school. With a new school year, many advocacy organizations are gearing up to deliver programs that prevent violence and respond to violence on college campuses throughout the state. In our Back to School episode of the podcast today, we are joined by Margo Leitschuh, the Prevention and Implementation Team Lead from Missouri Partners in Prevention. Margo joins us for a conversation about their work to support student well-being and prevent violence, among many other things, on college campuses throughout the state. Margo, thank you so much for being here. We certainly appreciate it.
Thanks for having me.
As we're getting started, can you let our listeners know a little bit more about yourself? What is it that you do at Partners in Prevention?
Sure. So I lead our prevention and implementation team. Our organization divides kind of into our research team with an implementation of a statewide survey that I'll share more about, and then our prevention team, which really does a lot to support our campuses in creating healthy and safe environments for students through a variety of projects. We focus mainly on issues and behaviors related to students' alcohol, tobacco, and other drug misuse, mental health and suicide, and interpersonal violence. So our prevention team provides a lot of statewide programs, both online and live trainings, like educational programs and campaigns for campuses, and providing some specific services to the folks we work with, like strategic planning assistance and like allocating and tracking funding that we provide, things like that.
Wonderful. Thank you for that explanation. I heard you mention the words health, prevention, well-being. These are words that are really grounded in public health. I have a background in public health. You have a background in public health, but it's not a field that everyone is super familiar with. So when we use the term public health, what are we referring to? Like, do you have like a nutshell definition of what public health is?
I don't know if I have a great definition, but to me, everything is public health. There's a really great video, I think it's called like This is Public Health, where someone is going around a city and they just slap stickers that say like this is public health on anything that they think relates. And so it's like water fountains and garbage cans and buses, right? Like to me, public health really is the foundation of our society as we know it, right? Like the field in general is about bringing together a variety of actors to try to solve the problems that we see to, prevent disease, promote healthy and safe choices and lifestyles for individuals and communities. But I think you could really look at anything and tie it back to public health in some way, shape, or form.
Margo, you are speaking my language. I could not agree with you more. It's so true. If you really look at the issues out there, the problems, the solutions to problems, everything ties back to public health. In fact, I would go as far to say the world really didn't make sense to me until I understood public health. So let's talk more about that. How did you get involved in public health, and where does your interest come from?
Yeah, that's a great question. So I guess I'll say, I was always very interested in science and medicine from kind of a young age. I think I took my first biology class in middle school, and I was kind of hooked since then. I'm really curious. I love to ask questions, and I think science just lends itself a lot to that. So I took a lot of AP science classes in high school. I took medical science and forensic science as electives. I really had my heart set on something in the hard sciences. So I went to the University of Missouri, Columbia for my undergraduate degree. I originally started as a chemistry major. I'd worked in a neuroscience research lab for a couple of summers. that did research on like neurodegenerative brain diseases. And it was really fascinating. But after that first year in school, I kind of realized it wasn't totally for me. So I wanted to look for something that was non-clinical. I also realized I was not cut out for medical school or clinical work. I'm like a fainter. I can't handle it. So I was going in my sophomore year and I wanted to change my major. I kind of took a look at what Mizzou had to offer. And very luckily, they have a thriving health sciences program, which seemed related enough, but in a little bit of a different direction. So I started to take some courses there and pretty quickly latched on to public health as the thing that really excited me. It had enough of that science and theory, but was a little bit more of a softer science. And I wasn't sure at the time, I didn't know if I wanted to go into policy and leadership or healthcare administration. I was still kind of figuring that out. But that same first semester of my sophomore year, I also was looking to get more involved. And I saw a little blurb in an MU info email about the MU Student Wellness Advocates, which was a peer health educator program based out of the Wellness Resource Center at the University of Missouri. So it sounded kind of right up my alley. They talked about presenting and public speaking and educating other students. I also have a theater background, so I was always very comfortable talking to, public speaking and talking to people. So I applied, I was accepted, and I really started getting involved. I helped with spring recruitment that next semester. I applied to be one of the co-chairs for their Alcohol Responsibility Month, which was kind of the big event planning piece of the organization. So I sort of just kind of worked my way up. And then I also started working at the front desk in the office. And I was just very fortunate to be able to eventually transition into a full-time role. I was wrapping up my undergraduate degree at the same time a coordinator was transitioning out. And I'd been around for a couple of years and put in a lot of hard work. And so I think it was just again, a very lucky and natural transition into a full-time role. So I've been with PIP since January of 2017, right after I graduated.
Wow. Thank you for sharing that. I love to hear about people's origin stories. I just find it deeply fascinating. And it's always cool to think how you have these skills in other areas like theater and hard sciences, but you can really draw upon those in the work that you're doing for public health, because like you said earlier, public health is everything. So when we talk about health, I think people often think about individual health, and that's really more about medicine. Whereas public health is really looking at the health of a community and focusing on health promotion, often by preventing illness from happening in the first place, but also efforts that support individuals' health. So there's a lot that goes into public health for sure. But as you were talking about it, I could hear the excitement and the passion you have for it really shines through as you talk. So knowing that these are huge issues, and that public health is guided by pretty distinct principles. Are there any principles of public health that you want to give a shout out to or that really apply?
Yeah, great question. And you really kind of took the words out of my mouth. I think the first one is community, right? It's in everything and we're all connected and interdependent. While, like you said, we do make individual choices about our own maybe health or health behaviors, oftentimes those do still maybe impact others, or the choices that we're able to make are influenced by the conditions in our environment or our ability to have insurance or access care or whatever that looks like. So public health really is about building those agencies and institutions and systems more broadly that collaborate together, that should have people's best interests at heart, that support their ability to make good, healthy decisions. So that I think is really key. I think one of the other principles that I find, again, really important is the science base and scientific method. We can have hypotheses, we do research, we test, we see what works, and then we act on that information. And I think, unfortunately, to me, currently, we're at a time where science is being attacked, discredited, discounted, and it's a shame and quite frankly a little bit of an outrage, because that's how we get knowledge. It's how we know what we need to do. It's how we do better and make improvements so that people can be supported. And then finally, I think just, again, you cannot talk about public health without talking about the relation to equity and justice. We should be seeking to make a better world for everyone, and that involves understanding and addressing the health disparities and differences that we see. So we have to work with communities to build accessible services, policies, programs that provide those opportunities for people to better their health and well-being.
You're getting me all worked up about public health, Margo. I totally agree. And I love how you tied in the role that equity and justice plays in public health. And one thing that gets really appealing to me about public health is the promise of the large scale impact that we can have when we're working at the community level. It's so really exciting to think about what a big difference we can make as people who care about equity and justice when we're applying a public health approach. So I could talk to you about public health all day long, and you have so many great things to say about it, but this is the Missouri Coalition Against Domestic and Sexual Violence, and I really would love to hear more about your work around violence prevention. And so as we're starting that conversation, would you consider domestic and sexual violence to be public health issues, and why?
Yeah, absolutely. To me, a public health issue is anything that puts people at risk of experiencing worsened health or mental health outcomes. And unfortunately, we know that domestic and sexual violence does that. We know that especially for college students, but for anyone, right? There is tremendous negative impact on poor grades, potentially, attrition and dropping out of school, mental health concerns and other behaviors, including, unfortunately, suicidality. I'll share more about kind of some data that we know to support that. But we know there's a lot of overlapping risk and protective factors for domestic and sexual violence with other public health issues like substance misuse and suicide. So in PIP, we often say prevention is prevention, because if we are addressing or looking to address the underlying causes and factors that might be at play with things like domestic and sexual violence, it's likely that overlaps with preventing some other type of public health issue as well. So yes, it's again, all interconnected.
It really is. And so with this public health approach, I love that you called out risk and protective factors. So with a public health model, we can look at programs that reduce the risk and increase protective factors. And there you go. That's violence prevention in a nutshell for you. So I'd love to hear more about your work at Partners in Prevention. What initiatives are you all currently working on?
Yeah, great question. So I guess we're a statewide coalition of colleges and universities. I mentioned kind of those critical health behaviors that we address. We're funded by the Missouri Department of Mental Health, the Missouri Department of Transportation, and the Missouri Department of Health and Senior Services. We have a variety of initiatives. We have multiple other full-time staff members who work on a lot of those projects. I primarily work on our projects related to mental health and suicide prevention. We run a free online suicide prevention training called Ask, Listen, Refer that just teaches people the basics of what to look out for and be aware of when someone might be experiencing thoughts of suicide, and then how to have that conversation with them when you're concerned, and then refer them on to resources and get them help. So we have a campus version of that, but we also have a free community version that is available to anyone. We also have a community coalition-based project called the Missouri Suicide Prevention Coalition Academy that really works with local suicide prevention coalitions for them to get more training and technical assistance on suicide prevention work and doing efforts in their communities. And then finally, our Engage multi-level violence prevention program is another initiative I work very closely on, which I know I'll share more about.
Wonderful. Sounds great. Can't wait for that. As you were talking, I was just wondering, are all college campuses in Missouri members of Partners in Prevention, or what's the breakdown on that?
Yeah, that's a great question. So no, not every institution in the state is a member. Currently do have, I believe it's almost all of the 4-year public institutions, many of the 4-year private institutions, some 2-year schools and technical colleges. We're open to any campus in the state that's interested in accessing our services. We certainly provide a lot of services that you don't have to be a member for, but there are some specific kind of requirements and deliverables that member campuses have that not all are able to meet. And so we often describe, if a campus is interested, date us for a little while, figure out what we're all about. And then if you think it's a good fit, then we can talk next steps about joining. But if you just want to do our survey every year, or you just want to use our, online suicide prevention training program, totally cool. We're happy to work with you on that. So yeah, a little bit case by case, but we I think are currently at about 28 member institutions.
28 members. Wow. And I'm sure there's a lot of diversity in the college campuses that you work with. And certainly a lot of diversity within the students that go to those colleges, right?
Absolutely.
But I'm wondering just what your perspective is as somebody who's really focused on working with college students. Like, what issues are college students concerned with right now? What's kind of front of mind for college students in a general way?
Yeah, that's a great question. I know many, and this shows up on our survey and in just a lot of conversations we have with the professionals as well, is that like stress and mental health are really kind of the top concerns. From our survey data, we know that around probably 1/3 of students are reporting like higher level stress kind of in the 2 weeks prior to when we survey them. Around 3/4 of students report experiencing some type of mental health concern in the past year, whether that's anxiety or depression or chronic sleep issues, things like that. More generally, I think students just, they have financial concerns. They are worried about the rising cost of higher education, paying off debt if they've had to take out loans, and then just concerns about like entering the job market and finding a job in general. And then finally, kind of sleep and general well-being. I know many of them, they're active. They're involved in clubs and organizations. They've got their schoolwork. They have their friends, right? Like they're trying to do all of these things and lead very full and active lives. But they also need to like balance their own capacity and not spread themselves too thin. And I think that can be a common challenge that college students experience.
That's so interesting to hear you say that. And I know as you're kind of wanting to meet college students where they're at, provide programs and services to support well-being based on what their priorities are, I'm wondering, as you're looking towards the future, are there also additional like emerging issues that Partners in Prevention is keeping an eye on, things coming down the pipeline that you might want to speak to?
Yeah, good question. I will say, I guess more recently we've started monitoring some things specifically around tobacco and nicotine use. We're seeing actually that some of those like Zyn, nicotine pouches, like nicotine products are becoming a lot more popular. So it's not necessarily like chew and dip in the old kind of smokeless tobacco way, but we're starting to see those numbers of like past year tobacco and nicotine use really rise for the first time in the last couple of years, solely due to that, but that's certainly a contributor. Cannabis in general is something that we've had our eye on for the last couple of years, even sort of pre the passage of Amendment 3, which legalized adult use cannabis in Missouri. That was when we started to see rates creeping up more. Now that it's been legalized, it's honestly leveled off a little bit. So that's good to see. We're glad it's not like skyrocketing. And a lot of students, well, first of all, most students don't use cannabis. And those that don't really say that they're not interested in trying it. It's not something that they're wanting to do. So that is good to see. But we have also seen kind of an increase in edible use. So things like gummies, candies, like THC beverages, that's sort of taking precedence as the most popular form, especially among college students. And because it's like easier to conceal, it doesn't have that like odor in the same way. That's something we've really tried to talk with campus partners about because it's just a little bit different than it used to be. But we always say that like the most commonly used substances among college students are alcohol, nicotine, and cannabis. Like we always encourage campuses not to like chase the fads or the trends that they hear about. Often those are temporary, and our work kind of remains the same regardless of what like the new thing is for the most part.
That's so fascinating to me. It's been several decades since I was in college, and so it's really just interesting to me to hear about kind of what those trends are that college students are focused on, knowing, of course, that college students are not a monolith and there's a lot of diversity there. You mentioned earlier using results from your survey data, and I would love to hear more about the survey that you were referring to, and especially any findings you have related to sexual violence and interpersonal violence, I think would be really great to hear about too.
Yeah. So our survey, it's called the MOCB, or the Missouri Assessment of College Health Behavior Survey. We implement it with all of the campuses in our coalition, but like I mentioned, other campuses are still able to participate. We do this annually every spring semester. It's an online survey that we send out. And typically with most of the campuses, we do like a random sample of the campus population, unless the campus is small enough, and then we may survey everyone. But students are asked to self-report behaviors and experiences related to like alcohol, tobacco, and other drug use, policy awareness and enforcement, stress, well-being, mental health, suicide. We do have some questions around sexual health and food insecurity, like just some other kind of general well-being topics. And then, like you mentioned, interpersonal violence, bystander intervention, things like that. So we conducted our 2025 survey around like February, March of this year, and we're typically able to have data back to campuses by like June. So it's a quick turnaround time, and honestly, they then use a lot of that data for like a research to practice. We want to put it in their hands. They develop strategic plans over the summer, and then they know what they're looking to address kind of for that next school year. So a couple of like high-level data points related to sexual and interpersonal violence. Around 30% of Missouri college students say that they've experienced some type of abusive relationship in their lifetime. And about 14% say that they've experienced an abusive relationship in the past year.
Interesting.
So one thing we often try to drive home with campuses is that students, unfortunately, like when they pack up all their stuff to come to college, they're probably packing up some experiences of trauma, some things that have happened to them, again, before they're ever going to set foot on your campus. But they might have, again, mental health needs or services and support that they'll need like day one when they get there, or that they haven't been able to access while they've been at home. So we ask again about those like experiences in the lifetime and past year, because we want to know kind of what the scope is. We also ask about experiences of non-consensual sexual contact, which we just leave very simply like sexual contact against their will. We know that might constitute quite a bit, but we never want to push more to avoid re-traumatizing students. And so unfortunately, about 1 in 4 students say they have in their lifetime experienced non-consensual sexual contact. And it's a little bit under 5% who report experiencing it in the past 12 months.
So these are pretty high numbers.
Yeah, we've had around 5,600 students who completed the survey in 2025. Varies year to year, but some years we've had upwards of 10,000. Other years it's, half or a little more than that. But we've been doing the survey since 2007, so we do have also some good trend data over time to see how things have changed and kind of what's shifted.
Is there anything you would speak to when you're looking at trend data over time?
Yeah, specifically related to interpersonal violence, I think more in the mid-2010s, we did see a little bit of that like Me Too effect, if you will, that people were more likely to report that they'd experienced interpersonal violence on our survey. We didn't necessarily think that it was truly a huge increase in perpetration, but just that students were more aware maybe of what had happened to them, more willingness to disclose, and just kind of that comfort with saying like, this is what happened to me. I've seen more representation of this, and so it's making me realize that I have experienced this. Yeah, just sort of broadly, typically has remained either pretty constant, especially related to experiences of non-consensual sexual contact, but some of that lifetime experience, again, we did see.
Yeah, and I think zooming out a little bit, it's interesting because we saw a lot of that same trend with more reporting of sexual violence, more, I think, survivors identifying what they'd experienced as sexual violence around the time of Me Too, too. And that was reflected in results from national surveys that went outside of just college campuses. So that's interesting to hear you say that. So we have talked about violence prevention, but you all are really addressing student well-being in a comprehensive approach. And I think anybody that's worked with survivors of domestic and sexual violence in an advocacy program knows very well that we're never just dealing with the domestic and sexual violence. There's often issues around health, mental health, substance use, suicidality, many, many issues that come into play. So can you talk about these interconnected issues a little bit in your work at Partners in Prevention?
Yeah, absolutely. Like you said, they are very connected. One thing that we really like about collecting our own survey data and being able to analyze it is that it does allow us to like cross-tabulate and see kind of the experiences of various students, either based on like demographic categories that we ask, or like to kind of look at overlapping experiences of like certain behaviors. So what our data clearly shows is that students who have experienced interpersonal violence are more likely to report mental health concerns and thoughts of suicide in the past year. They're potentially more likely to be using substances, particularly cannabis, but also others, in a more high-risk way, likely as a coping mechanism. I can't remember if we've looked specifically at like data related to retention and interpersonal violence, but what I would hypothesize is that students who have experienced interpersonal violence are more likely to say that they've thought about transferring or quitting higher education altogether. Again, maybe specifically related to like a perpetrator still being at their campus, or just more generally like not wanting to be in those same places and spaces. And again, just struggling more broadly.
And so I think that when we develop programs and responses that really address those intersections, we are developing programs that are better equipped to actually increase health and increase public health. So I'm always interested to hear about all of those connections. Partners in Prevention is a statewide agency. Missouri is a big state. We have over 6 million people that live in Missouri, and I think that each region has its own distinct personality, its own characters. You and I both work at statewide organizations, and I would love to hear if you have any thoughts about kind of the nature of working in different regions throughout the state, or anything you would say to that.
Yeah, that's interesting. I guess from my perspective, I'd say we don't necessarily see it like regionally, but more so differences based on like where campuses are located. I think we do see a little bit more of a split in our like urban versus rural schools. Yeah. I think typically with some of our more rural campuses, they have fewer resources that they might be connected to or able to refer students to if needed. They themselves may not have as much just like funding or staffing, or might struggle with like recruiting and retaining staff in some of those more rural areas. I think we also see a lot more differences between our 4-year campuses and our 2-year schools. We've taken on a lot more 2-year schools in the last 5 or 6 years. And I'd say they, again, have some of those same challenges that more rural schools do, but they're also, like you said, kind of working maybe with a little bit of a different student population. We see that among 2-year schools, they have a much higher representation of students who are the first generation in their immediate family to attend college, or who are Pell Grant eligible, so may have additional financial needs. So I think there are also just additional supports and considerations that they have in supporting the students that they serve. So those, I think, are kind of the two major distinctions. We haven't seen a ton of difference when we've looked at like public versus private, or like along some other types of categories, but I think those are more so the ones that we see.
Yeah, I can echo those sentiments around barriers and differences in rural and urban domestic and sexual violence advocacy programs. We definitely hear about a lack of resources in urban areas, but in rural areas, we often hear about just extreme shortages of childcare, transportation, healthcare, substance use treatment, the full gamut. So we are huge fans of Partners in Prevention here at the Coalition, and we have a long history of partnering with one another. We certainly appreciate the work that you do. And so would you say anything about that partnership or the relationship we've had over the years?
Yeah, so I know there is a long-standing history. I think it predates me a little bit, but probably for the last 10 years or so, I know we've partnered well together. I know one of the major projects that we worked on kind of early on in my time was called the Intern Resource Network, which was meant to be like a resource for students about their rights and resources if they had experienced interpersonal violence while at like a job or internship. Like I mentioned, we do ask about experiences of non-consensual sexual contact, and we do ask like where or kind of in what capacity it happened. And at the time, especially, we were seeing some higher rates of students reporting that it was occurring in those places. And so we knew we wanted to make sure that students knew that they're still in their capacity as a student at a placement like that. And so they need to know how to report and how to access resources in that event. So yes, I know that was something we partnered on, and we're really excited to get up and provide to students. I know we've also just done a lot of like training and education for our PIT member institutions on domestic and sexual violence, on like legislative updates during session, just how to utilize you all as a resource and, connect with maybe their local domestic violence agency or shelter, things like that. And you all have also been great partners in giving us feedback about our annual survey and just ensuring that the questions that we ask are trauma informed, or that, again, like provide useful information for the work that you all do as well with college students. So yes, it's been great to be a partner of your all's. I know all of your staff members that I have worked with have always been just so wonderful and lovely. So yeah, it's been great for us as well.
Well, right back at you, Margo. I think we really draw upon your expertise on working to support college students, and we're always available if there's anything we can do around domestic and sexual violence advocacy and connecting you with our locally member programs. So one of the cool things that we partnered with Partners in Prevention is that you and Molly actually presented at the last biannual MOCADSV State Conference. I was lucky enough to get to attend your session, and it's one of the reasons why I was so excited to have you on the podcast today, because it was an excellent session. Can you share with our listeners what you all talked about, what you were presenting on?
Yeah, absolutely. So Molly Lindner is our communications assistant in Partners in Prevention, and she and I presented on Engage, which is our multi-level violence prevention program designed in partnership with MOCADSV, and it's currently funded by the Department of Health and Senior Services Office on Women's Health. So it's a bystander intervention program. I can debrief what that entails in a minute, but really aimed at looking at how students engage in their communities around like community connection and sense of belonging, but also needing some of those skills of how to recognize when something is wrong, what to do about it, how to support someone who might be at harmed or at risk of being harmed. And again, like what to do and how to support them in those situations that they might encounter on campus.
Yes. And so what is bystander intervention if somebody's never heard of what that approach is?
Yeah, I think of it just as like that process of recognizing a potentially harmful situation that could be related to a variety of like topics and doing something about it, taking some type of action to prevent, reduce, or respond to that harm. That simple, like if you see something, do something kind of concept.
So it's people who are witnessing the issue, who are impacted by the issue, taking action to intervene. So as Partners in Prevention was developing Engage and was looking at different models that were effective in preventing violence, what made you go with bystander intervention? What was your inspiration behind that?
So I guess to like backtrack, a little bit, the inspiration really for developing a homegrown program came from the Department of Health and Senior Services. So DHSS had been funding Green Dot in the state, which some folks are familiar with, but also a bystander intervention program. So they were investing in that, and they were funding around 5 or 6 specific campuses to implement that program specifically. And Green Dot is great. I'm not here to like criticize it. I think for our campuses, they were not seeing some of the outcomes long-term that they were hoping for. And there were kind of multiple barriers that existed for them to utilize it. So like a key one was that Green Dot is only about sexual and interpersonal violence. There is no flexibility to discuss how substance use might be at play or bias and discrimination, like other related topics where violence and harm might occur. Again, just a pretty set standard curriculum. And peer educators couldn't deliver content, and especially for some of our smaller campuses or more rural folks who don't have dedicated staff, like students can be an immense asset in programming, and that was just always a struggle to get people trained and be able to implement sessions. And training for facilitators was only hosted about once a year, and it was a full 4-day commitment. So campuses just, again, that was a barrier for them. So the Department of Health and Senior Services approached us to start to develop something new that could be flexible and adaptable for campuses, that could address multiple topics, like including alcohol and drug misuse, things like that, and that would just be, again, a little bit more accessible, that wasn't kind of a barrier based on cost or other things. So we were tasked with creating something that would address alcohol and other drug misuse, bias and discrimination, personal violence, and mental health and suicide. We also wanted to kind of change the framing that we were hearing from students about bystander intervention programs. A lot of what was expressed is that students felt like in these conversations, they were being shamed or judged for maybe not doing something or not knowing what to do. So we wanted to kind of flip the script and reframe it around like community connection and sense of belonging, both of which we know are protective factors for violence and harm. And when we would run our MOCADSV data, we saw that typically students who were more engaged in campus activities or who said that they felt they had the responsibility to do something or, to be like an actor in other students' health and well-being, they were more likely to say that they had done something if they had witnessed a situation. So we needed them to feel connected enough to want to do something if they were to be in those situations. So that was kind of the major background. I guess a little bit into kind of our process for developing the program. First, we did like a pretty extensive literature review, took stock of what existing bystander programs were out there. I guess I should say too, we know that bystander intervention is a strategy that works particularly well with this age group, with college students. And again, just if they're in this set community, they're in a lot of these situations, they have regular contact with each other, and there's good data to support that teaching them skills and having them, again, be able to address these things is sound research.
Like those peer relationships are so important. That makes so much sense.
So we did actually a different survey with students I think we called it like the Campus Culture and Bystander Engagement Survey, just to learn more about what students had witnessed or experienced, but also to just we asked them what they thought about the word bystander, and most of them hated it. They're like, that's somebody who literally just stands by, who doesn't do anything. They had a very negative connotation with it. So we really try not to refer to Engage as a bystander program. And when we talk about students doing something, we say you're acting as an engaged community member. If you're an engaged community member, you'll take these steps to produce, prevent, or respond to harm. So we did that survey, and then MOCADSV staff actually worked with us to do some interviews with our campus staff members to learn more about their experiences with programming, what kind of needs they had, what kinds of things they really wanted out of a new program to implement on campus. And as we were developing the actual content, we convened multiple work groups of professionals, just again, to get their thoughts and feedback. We did some demo sessions with students and again, did some focus groups afterward. We tried to put it in front of as many people as possible. Because like you said, we know there's a lot of variety, and we know there can commonly be pitfalls when it's a handful of staff developing something that, again, might not be accessible or relatable for campuses. We also did try to just keep it as flexible as possible. We very much so have been if the scenario that we crafted doesn't speak to your campus population, maybe it happens in a residence hall and you don't have residence halls, work with us. We'll develop something new that is more reflective of your students' experience, things like that. So we've really just tried to be, again, good partners as we've developed this program.
I love that. Thank you for explaining that. It really walks us through how you had this vision, understood the need, and were able to turn it into a program that met that need and has such promising potential to make a huge difference. So you did all this planning and development. What was the implementation like?
Sure. So I guess along with the development, what we ended up with were we love the socioecological model and partners in prevention. And so we knew we wanted something that would address individual knowledge, but also that again, peer level. These situations are happening when people are together, and again, that broader community level. So we developed a brief, what we call our online introductory training. That's just a very simple, self-paced module to introduce them to the concepts of this program, again, to talk about the importance of community connection and care and inclusivity, introduces them to our steps for intervening, to lay that foundation and framework. And then we use something called the CARES acronym instead of the 4Ds, if you're more familiar with that. But basically, what are their options for doing something? And an engaged community member cares. And so that was also easy enough to remember. So we outlined all of these pieces and developed also some in-person training curriculum, although we really refer to them as facilitated discussions. That was another piece of feedback we got, is that students felt like they were sitting there and they were being lectured at. They were being told what to do and they were being told how to do it. And there was not a lot of flexibility for them to talk about the barriers or challenges that they might have to intervening, or just, again, all of the things that they might be navigating in those instances. So we developed some scenarios with characters to put in front of them and then have them really talk through, who do you resonate with in this situation? Is that something you would do? Why? Not. So it really is more of a discussion. And we have gotten a lot of positive feedback because students they're given more opportunity to process through, to think it through. It's not so much a black and white, this is the correct decision and that's the wrong decision. There are multiple options. Figure out what works best for you. Every situation might be a little bit different. And so again, just acknowledging that not every situation is going to be the same, and And unfortunately, there's gray area, right? Like things might not always be as simple as we want them to be. And I think giving students that breathing room has resonated really, really well. Anyway, so we have these kind of facilitated discussions. We have an overview training that talks about alcohol, bias, interpersonal violence, and mental health kind of all at the same time, which is also something that not all programs do. But we also developed what we call deeper dives, knowing that there may be a time when a professor reaches out and wants you to deliver a session about, alcohol use. And so you maybe go into a class or a club or something like that, and you still want to talk about these concepts, but every kind of scenario or situation is going to be more specifically related to that topic. And then more broadly, we've developed like social norms campaigns and other promotional kind of items related to the program. We've encouraged campuses to like connect with other departments and like co-brand engage. If you're doing a community cleanup day, that's engage. The whole point is to get people more connected and involved in their communities. So kind of broadening the mission or the goals of the program in a variety of ways across campus.
I love how, as you're developing the process and implementation, it's very clear that you are committed to being very student informed. And I almost want to say like user friendly. Like these are tools at your disposal that you can pick up and use, and it's not a heavy lift. It's really exciting to hear that. Were there any unexpected challenges that came up as you were developing or going through the implementation phases?
Yeah, absolutely. I think one thing, we had all this information about the barriers that campuses expressed of like, well, this is too expensive, or again, that facilitator training takes so long. So we developed like an online self-paced, takes a couple of hours, facilitator training. We created like a resource portal and have, all of the materials and supplemental documents and all of this together. We started like biweekly office hours for the program. At one time, we had monthly like facilitator support sessions for people to come and, share challenges and things with each other, talk about it. And I think a big, not really lesson learned, but like, unfortunately, sometimes you can build it and they might not come, right? Like it's still going to take additional, like we can remove barriers as much as possible, but it's still kind of a timing thing. Like, is the campus ready for this? Or are they appropriately staffed? There might not be anything, unfortunately, we can do about that. We can try to help as much as possible. And again, make it so that students or others can deliver sessions and things like that. But even if we remove every single barrier, there's still going to be other things.
That's life. It happens.
Exactly. So I think that's kind of the biggest takeaway is just to keep at it. I guess I think we first launched and had campuses doing sessions probably in the fall of 2022. It's probably been about 2 to 3 full years of implementation and, staff turnover and just like changing administrations. Like we've seen all of those things too as potential just challenges that campuses continuously have to navigate. So even if they have great momentum for the program at one point, sustaining that momentum is a challenge kind of in and of itself.
So you all have rolled out Engage on several campuses for 2 or 3 years now. What's the current status of the program?
Yeah, so I would say we probably have about 5 to 6 campuses that are actively delivering sessions semi-regularly, that are encouraging or requiring students to take that online introductory training, and that have some sort of like team of people that are implementing this program. But we're constantly having conversations with campuses about it. If they're kind of revamping their team, or if they're just getting started and finally at a place to train some facilitators. And we're always kind of creating new programs or materials that campuses can use. We had one campus who really wanted to do more work within their residence halls, but they didn't think it was feasible to get all their residence assistants trained. So we developed these like activity boxes that you don't have to be a facilitator to do them. It's important to just know about the concepts of the program. But you could do this with your floor and still get across the concepts of the program, have them practice some of these skills, but they're not sitting, in a lecture hall listening to this or like having the same kind of discussion. So again, we've just really tried to be creative and flexible and work with campuses when they approach us with things that they need.
And I think when it comes to public health programs, there's so much to be gained by being creative and flexible. You can make a lot happen around that. I would love to hear, though, as you are rolling into potentially year 4 for some of these members, have you collected any data about the impact of Engage, heard any testimonials, or gotten any feedback about it?
Yeah, that's a great question. So we do pre and post test surveys with people who sit through facilitated discussions. Some high level outcomes, we have seen that overall students pre to post test, they're more likely to say that they feel more, comfortable to intervene, that they feel like they have the skills and resources. So we know there is at least some self-reported efficacy. We're not at this point doing any kind of like longitudinal, we're not sure how long afterwards that potentially may hold, but we are seeing at least students say that they're seeing some change. As far as like reflection on the MOCADSV data, I think that's a little bit more difficult to quantify. And certainly there are a lot of other things at play related to the experiences that students have that we know. Like I said, they may have lifetime experiences that, a bystander program in college couldn't have prevented necessarily. So that's a little bit tougher, I think. Overall, we have also just gotten some positive open text feedback of like, I appreciated that this was a little bit more, again, like not informal, but not quite as like scripted or structured. I felt like I had the ability to, share something, and, the facilitators kind of guided us through this, or, so overall, I think for both campuses who have done the implementation and students, it just feels like a little bit of a better fit for our campuses overall.
Well, I think that's so significant when we're dealing with these issues of domestic and sexual violence that are so huge, that are so deeply ingrained in just day-to-day living here in the United States. To have something that you can actually do and take action on just feels so promising. And so as you're looking towards the future, what are your hopes for Engage? Where would you like to see it go in the future?
Yeah, that's a great question. Yes, I would love to see more of our campuses being able to utilize it more fully. This is probably a 10 years down the line thing, but I know Green Dot does have, I think, like a high school version and a community version. I could see something similar to that being useful for Missouri as well. Again, just the ability to recognize the overlap between these issues and recognize that a lot of the same skills go into being able to prevent, reduce, or respond to harm. So maybe a ways away off dream, but I think the principles and the concepts are critical now more than ever, and could be infused in a lot of different spaces to encourage people to be connected to their community and like support and stand up when needed.
Yep. I can't wait to have you on the podcast in 10 years, and we'll talk about what Engage is up to in the next decade. So thanks for sharing all that information. It really is inspiring to hear the process you went through and the impact it's having on college campuses here in Missouri. And it's something that's so unique to our state and a special thing to have. So thanks for your work on that, Margo. And to all of Partners in Prevention for developing it. I know that your expertise and background is really in working with college campuses, but I wonder, in your work with college campuses, do you have any thoughts about how domestic and sexual violence advocacy organization can partner with college campuses?
Yeah, that's a great question. I think it really is about like building those relationships and making those connections. We always say, like, reach out to us. Sometimes campuses might seem very insular, or maybe you're like not aware of who the best person is to reach out to, or campuses themselves sometimes I think don't know exactly how to capitalize on some of the great work that's being done in the community, or they're not sure like who really is going to be a good partner. So not that we have to mediate those relationships, but we're always happy to facilitate that relationship development. So if you're not sure who to reach out to, feel free to reach out to us. But again, I think even just like, I know about your organization, or, I know you're in this Relationship and Sexual Violence Prevention Center on campus. I'd love to get coffee and just talk about how our organizations could collaborate, or I just want to know more about what you do. So I think that's always a good first step, and then hopefully those partnerships develop from there.
So true. And you mentioned that Partners in Prevention is a resource in kinds of making these kinds of connections happening. But I wonder, just more generally, do you have any favorite resources related to public health or violence prevention, like books, podcasts, nonprofit organizations, anything you want to give a shout out to?
Yeah, I guess I'm a big reader, so I always have book recommendations. A couple of health or public health related books that I really love. The first is called The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare. It's by T.R. Reid. I read this when I was in college, and it was so eye-opening about our healthcare system in the US and how there are different approaches abroad. I mean, I think it just sparked so much more interest for me in public health. Always recommend that one. And then another that I read just this year is called Invisible Women, Data Bias in a World Designed for Men. And it talks about how a lot of studies and research are done on men or like men's bodies. They like crash test dummies. They do a lot of that research based on the average build for men, and they don't take into account that women are often smaller and, have different potentially like biological and physiological differences. So that causes negative health outcomes, right? Like it is a public health issue when we don't take into account fully half of the population and the needs that they have. So I could go like on and on. But we did actually develop a book list in Partners in Prevention a couple of years ago, with a lot of good recommendations. So I know that's on our website, but I can send it to you. And then one of my favorite podcasts is called This Podcast Will Kill You. And it's about infectious disease. And it's these two women who, I think one is a medical doctor and the other is maybe like, she's like a disease ecologist or something. It's fascinating. And so they talk about like the history of certain diseases. They talk about like mechanisms and how it operates in the body. And then like a modern update, like is what's happening with this disease today? Is it eradicated? Is it still an issue? It's really fascinating. It's definitely not for the faint of heart because it can get a little like anxiety inducing, but it's so interesting.
Thank you for sharing those. I'm so excited to check all of those out. And we'll be sure to share the link for the book list from Partners in Prevention in the show notes for this episode. But I love to hear about what people are reading, what people are listening to. So thanks for giving a shout out to those. And because this is our back to school episode of the podcast, do you have any tips about promoting well-being on campus as we are headed into the new school year?
Yeah, I'll share. This was kind of a, I guess, more New Year's resolution for me, but I really loved this framing and I would encourage others to take it forth. I'm kind of centered around 4 C's. So create, cavort, consume, and commune. So like create, have something creative that like feeds your passions that you're, you could take that a lot of different ways. It could be cooking, it could be artistic, however, but like doing something that produces. Cavort, like get out, do something fun, take some time for yourself, but be active somehow. Consume, so like it's okay, like consuming movies or music or books or whatever your, hobby is. And then commune. We need to be getting together. We need to, find community and connection. So that was kind of just like New Year's resolutions that I set for myself to keep those top of mind. And I think that lends itself to the school year as well. And also just like, it's okay to take it slow. It's okay to, do some deep breaths and take each as it comes. I know there's a lot of excitement with back to school, but it can also be, again, a time of change, and it's always okay to slow down.
Yes, I totally agree. And I was taking notes as you're talking about the 4 C's. I can't wait to think more about what I can do in my own life with those. That's a great little framework. So as we're wrapping up our episode, I was just wondering, you've talked so beautifully about community connectedness, about prevention, about public health and belonging. Are there any final thoughts that you would want to share about your philosophy and approach at Partners in Prevention that maybe advocacy programs could consider and integrating into their own services?
I don't know if anything necessarily different than probably what I've shared already, but again, I think at the end of the day, it's just a good reminder that like we're all human and we all exist on this planet together. And so it's important that we, again, have that community and care for each other because it's what each of us deserves.
I couldn't agree more. Thank you for just saying that so beautifully. It's truly inspiring to have this conversation with you, Margo. And finally, I just was wondering if people want more information about PIP, where can they find that at?
Great question. So our main website is just mopip.org. We're also on most major social media platforms at Missouri PIP. So those are kind of our main channels and spaces that you can find us.
Well, Margo, this has been a fantastic conversation. I learned so much from you, and I just appreciate you taking time to talk about your work at Partners in Prevention and around violence prevention in particular. So thank you, Margo. It's been such a delightful podcast episode today.
Thanks so much for having me. This was great.
And thank you, listeners, for tuning in. We look forward to bringing you another episode of Momentum for Change next month. And until then, stay safe, and thank you so much for listening. Thank you for joining us. This has been a recorded conversation now available in both video and podcast formats. A video recording of this episode is available on the MOCADSV YouTube channel under the Momentum for Change playlist. Please subscribe to our YouTube channel in order to receive new episodes in your YouTube feed. You can also find all of our Momentum for Change episodes available to stream on Spotify or wherever you find your podcasts. Momentum for Change is a podcast produced by MOCADSV with post-production support provided by Tim Stillings and promotion by Adrian Maddox. Again, I am your host, Nora Mosby, and we appreciate you joining us for this episode. Thank you again, and we look forward to seeing you next month.